Hello everyone. Today we are here with Dr. Shaheenah Dawood. Hi, Dr. Shaheenah. How are you?
I'm fine, thank you.
So, before proceeding, could you tell us a little bit about your journey into medical oncology?
Was actually a budding neurologist, but one fine day I had a rotation in my training in oncology, and that completely changed my life in terms of the fact that I thought it was a speciality that one could truly make a difference. You can make long-lasting relationships, and I also found out that you can't cure diabetes, you can't cure hypertension, but you can cure cancer. And when you help that one patient, the satisfaction and the gratification that you get is so immense. That's why I dedicated my life to oncology.
So, every year, EIOC is organizing this event to escalate the awareness for the cancer treatment. In one line, what is the soul of EIOC and why does it matter now?
The EIOC is basically for the people, for physicians, for nurses, for healthcare personnel that work within the realm of oncology and for patients. And that's the soul of EIOC. It's giving back to the community so that we can educate and ultimately properly impact our patients' care in the clinic on the ground on Monday.
So, the event is often described as a bridge from global evidence to real clinical practice in the UAE across the Middle East.
Yeah.
How do you build the bridge in reality, people, format, outcomes?
So what we do is we build a program that's practically oriented, clinically relevant. It's not only sprouting out the data, it's actually taking the data, teasing it out, and showing how we can practically implement it in the clinic so that we can benefit our patients. That's how we bridge it. We do clinical case studies, challenging professors, as well as didactic lectures. At the same time, we've got workshops as well. So we aim to not only train, but also transfer that knowledge to be implemented practically in the clinic.
EIOC is DHA accredited.
Yeah.
Why do you insist on free accredited access and what ripple have you seen in hospitals and clinics because of that?
For us, it's never been about money. We want there to be no barriers for people to come to the conference and learn. Because if you can learn, you will take that knowledge back to be able to help your
More
patient.
about creating awareness.
Exactly. So we don't want there to be barriers. And I firmly believe that by having paid registrations, you are creating that barrier to prevent people from coming.
So beyond the Cancer Congress, APMEA keeps the learning alive. Journal clubs, fireside chats, and patient-centric forums. What gap does APMEA fill, and what kind of real-world change have you seen from this continuity?
So basically, as we move into the 22nd century, as I would say it, we now know that not all patients should be treated the same. We also know that we have to start integrating precision medicine. And that's what the Apnea Molecular Tumor Board is all about. That's what the EIOC journal clubs are all about. It is not only to allow for continuous learning over the year, because EIOC is only one time per year. So you want continuous learning over the year. We also want to be able to promote precision oncology because we want to be able to say individualized therapeutic plans for each person, each patient that walks into an oncology clinic.
So you have, I believe, different institutions like APBCS, YWF, APGCS, and BVOF. Each pillar focuses on a different lens.
Ab-
What unique value does each bring, and where are they moving the needles the most right now?
So basically, the APGCS is for gastrointestinal cancers. The ABCS is for specifically for breast cancer. The YW forum is for young women. And of course, BPOF is where we're headed because that's precision oncology at its best. And I think that's where we're moving towards integration of all tumors, all malignancies to be treated via precision medicine.
The event isn't just about oncologists. It's about surgeons, radiologists, nurses, nutritionists, and psycho-oncology. How does this multidisciplinary circle change the patient journeys in tangible ways?
So patient is not only treated by a medical oncologist, a patient is treated by a team of people. That team includes your surgeons, radiation oncologists, physical rehabilitation specialists, nursing. They're all there as part of the journey of the patient because that patient's journey needs to be as smooth as possible. And everyone in that team needs to be fully aware of how to manage a patient. So that's what makes, it amazing in 2025, where we know that a multidisciplinary approach to managing your patient improves prognostic outcome.
So, precision is a big word. In practical terms, how do EIOC and APMEA help clinicians make precise decisions simply, safely, and consistently?
So I disagree that it's a big word. I think it's a small word with big implications. And those big implications, we can help physicians, we can help nurses, we can help ancillary people come on board there in the management of patients who have cancer to be able to appropriately treat them. We convey that information in a simplistic way so that they can go and practice precision medicine.
So, you have many hats clinician, educator, convener. What personal experience keeps you pushing for accessible, high quality education in our region?
As a clinician, I see patients every single day.
Right.
And I wish and hope that I'm making that much of an impact on each and every one of those patients to make their journey better, to make their lives better. And that's what drives me ultimately.
So, as we look ahead, what would you like to see evolve or be highlighted even more strongly at the 2026 event to deepen the real world impact?
I want to see more patients attend because we've introduced patient advocacy groups. We need to help patients at every stage of their journey. I would like to see precision oncology blossom into a bigger part of the conference. And I'd like to see novel therapeutics even bigger. We started that this year because there's so many drugs that have exploded into the arena. And of course, artificial intelligence, how it will help patients ultimately by training physicians to help them.
Your message to frontline clinicians who haven't joined yet and to partners who want to support knowledge to care translation in this region.
Be humble. Learn. Learning doesn't stop. It's a continuous process. And help your patient at the end of the day.
Right. Thank you so much. Thanks.
Thank you.
Thank you.